Good afternoon, everybody. I'm here to, I'm pleased to introduce Dr. Neal Horen. He is the director of the Early Childhood Division for the Georgetown University Center for Child and Human Development, one of the leading national and international experts on early childhood mental health and early childhood systems. He has worked with diverse, across the 50 states and various tribes, territories, and communities with diverse populations, supporting the development of systems of care for these communities, for young children and their families in these communities. He's the director of mental health on the Head Start National Center on Early Childhood and Wellness, and has co-leaded development of hundreds of materials addressing trauma, infant mental health, disabilities, and staff wellness. Also building online recently with the COVID-19, building online professional development, curriculum for professional development on infant and early childhood mental health consultation. And he leads the National Center of Excellence on Infant and Early Childhood Mental Health Consultation, and is project director of the Center for Excellence for the center. And we welcome him, and we are very grateful that he's sharing his expertise with us. Welcome, Dr. Horen.
Thanks, Julieta. Yeah, I think those are just ways that I make myself feel better that I'm busy. So Julieta did not mention that the way that I have come to know the Mailman Center and Julieta more intimately is that I forced Julieta to work with me on some of our work on our National Technical Assistance Center through Head Start. And Julieta has been a part of a team working around mental health and disaster recovery with folks in Puerto Rico and the Virgin Islands, who obviously have tried to just corner the market on disasters. Folks in Miami, you like to talk about how you've experienced hurricanes. Try adding an earthquake or two, aftershocks, and throw a pandemic on top, and then come back and talk to us, apparently. So, you know, I've really enjoyed that work with Julieta, and I'm super happy to spend some time with y'all today. As it happens a lot, is when somebody says, hey, will you do a talk? I'll say, what would you like me to talk about? And they'll say, whatever you want. And I'm like, it doesn't matter to me. But as we talked, one of the things that occurred to me is a pandemic, you know, disaster tends to put a lot of people on even footing. If everybody has to go through something, they start to experience what it's like, whether you are wealthy or not, have a job or not, educated or not, whatever sort of factors you want to factor in, you're still going to not have electricity. You're still going to be online for gas or things like that. And so what's been very interesting to me during this pandemic has been the fact that now everybody seems to understand early childhood development or what it takes to support that. They understand trauma and stress a lot more than I think any of us ever wanted to, as we all are entering in various parts of this country week 10 of our quarantine, social distancing efforts and things like that. So all that to say that when I spoke with Julieta, I thought now's the time that those places around the country that have really thought about their entire early childhood system are in some ways at some advantage, because they've been trying to address the needs of children and families in a more systemic way and not piecemeal. And I've experienced this after other disasters, quite honestly. After Hurricane Katrina, I was called into Texas with a couple of small teams of mental health folks. And one of the things we saw in different parts of Texas where folks from Louisiana had either come by choice or forced to, was that those communities that had a relatively well-developed system seemed better able to address the influx of need that was coming into their community, and those communities that had never really come together really struggled. And so I thought I would spend some time with y'all talking today about an early childhood system of care. It might be a concept that everybody's familiar with, some may not. You're welcome to ask questions throughout. If I see them, I'll try and answer. We'll leave some time at the end. I know the most exciting thing for me every year around Memorial Day, right before that big Memorial Day weekend kicked off, was I hope I get to be on Grand Rounds and listen to somebody talk at me for an hour. So congratulations. I know that you're living your dream. So I'll spend some time talking about this. And one of the ways that I like to talk about this is in a different way than just the sort of dry, what's a system of care way. So I read a book once. That's it. That's the end of the sentence. I just read a book. So I read a book once about the development of Central Park. I'm sort of fascinated because I'm a child psychologist. I have only somewhat skilled verbal abilities. I don't have any visual spatial skills. I have no ability to build things or figure out how to put things together. So I'm fascinated by construction. I've read really interesting books about the building of the Hoover Dam or bridges or different things like that. And so when I read this book, it sort of struck me that it's pretty similar to how we build a system of care that supports young children and their families. And Frederick Olmstead, who was the sort of the leader of the development of Central Park in New York City, I think can teach us a lot about how we do this. This is some work that I've done. In addition to working on this National Center for Head Start and directing the Center of Excellence for Infant and Early Childhood Mental Health Consultation, one of the other places that I work is I'm the lead for early childhood for all the system of care sites that SAMHSA funds, Substance Abuse and Mental Health Service Administration, all the early childhood focused sites. And so I do a lot of work with SAMHSA on this kind of work. So I think it's really interesting to start to think about somebody who has nothing to do with children and families in some ways, and everything to do with them, but certainly nothing to do with their mental health and the social emotional development of young children. What does that have to do with what's happening in Florida, what's happening in Miami-Dade? So I want to spend some time. This is, for those who are not familiar, this is Central Park. And I grew up in New York originally. I moved to the South after high school. But this has always been fascinating to me as a young child, that in the middle of this massive city was this open green space that really was the center of the city in terms of sort of outdoor activity and things like that. And for me, when I read this book, it sort of struck me about how would you even go about constructing something like that. I'd always been interested. My great-grandfather was an iron steel worker in New York City, worked on some of the bridges and things in New York. And so I've always been sort of interested in this. So the people who sort of build parks, or if those of you who are familiar with the pyramid model or an early childhood system, it's all of you. And whether you're a researcher at Mailman or you're out in the community doing some sort of service delivery work or things like that, you're the people who do this. And while Olmstead came up with some sort of plan for this, it really was how everyone pulled together to put those ideas into practice. So I want to talk a little bit about this. And when I do, I always want to go back to, we all are thinking about young children. So this is one of my children. I have 4 children. This is my youngest, Isabella. And I think when we talk about early childhood systems, it's very easy to get lost in the arcane nature of like how a financing mechanism like child care development block grant funds can pay for mental health consultation. We'll talk about this because I know that's really piqued your interest. I can tell. But in the end, what we're really trying to do is help this child get to be a highly functioning, socially, emotionally competent part of our school system. For me, that's what school readiness is. And that's really what an early childhood system is preparing children in a social emotional way to be ready to tackle all the things that they're going to start to tackle once they get to school. So I say all that as sort of setup, and the goals for today are really just talk a little bit about early childhood systems. How does that sort of fit with what you all do and the system that exists in Miami and in Florida? Think about how different states approach this, and obviously a state like Florida and a community like Miami is going to be vastly different than how Missoula or the state of Montana are going to address this, and yet there are lots of similarities. And then I'd like you to hopefully start to think about some of the low-hanging fruit. Where are the connections in our system? How are we sort of seeing ourselves as part of a much larger effort? And I do a lot of work nationally. I don't do nearly as much work. I work at Georgetown in DC. I don't do much work in DC anymore. I used to, but I think for those of us who work at a community level, sometimes it's hard to see past the work we're doing. So I'm hoping that you'll sort of see some of this low-hanging fruit. Here's what's sort of the parallel process, and my infant mental health friends will appreciate this, that when they started to think about how they were going to build Central Park, first they had to do a lot of groundwork. They had to figure out, where would this be? There were not parks back in the day in New York City and across the country actually were closed. There was a lock and a gate, and they were generally for the wealthy who could then spend some time in the outdoors, particularly in a place like New York City. So a lot of groundwork goes into this, a lot of thinking about where is it going to be and the landscape of it. Similarly, when we think about an early childhood system, there's a lot of groundwork. What is it that we want our system to look like? What would it look like, for example, if we had an early childhood system in Florida or in Miami? You have one, but if you could sort of envision what you'd like it to look like, where all children were getting the types of promotive, preventative, and treatment kinds of interventions that they needed. They were all evidence-based. They were well-financed, they were sustainable. All of that is sort of groundwork that needs to be done just in order to start to think about what would we want that system to look like? What would the referral system look like? I do an exercise sometimes when I talk about systems, so I'll give you some, if nothing else from this discussion, you'll get maybe some training ideas. I take those little plastic Easter eggs, and I put little notes in them like Johnny needs a speech and language evaluation, or Susie needs to see an ophthalmologist, or things like that. And I put those notes in those eggs, and I have an audience of however many people come. Generally it starts out like this, and then everybody drops off by the end. But I like to think that they'll stay. And I say to them, your job is to read the note in here and get it to the right person. So I've given people their roles and things like that. And what inevitably happens in this exercise is people start throwing those eggs to one another, or dropping them, or laughing. And then I, at the end, remind them, this is what our referral system is. And if you don't sort of make a warm handoff, or if you drop it, or if you don't take it seriously, it's a family who's not getting where we want them to get. And that's that groundwork. Secondly, is a labor force. We need the actual workforce to dig and plant and put up gates and railings and whatever else we're doing in our park. And in many ways, the labor force in the early childhood systems in this country is woefully inadequate. We tend not to have enough people. I hear this over and over again. I spend a lot of time on calls with folks who are like, well, we do want to do mental health consultation. We just can't find people who are qualified to do it. It may be less of an issue in a large city like Miami than it is in more rural parts of the country. But when we think about the different components of your system, early intervention, education, special education, child welfare, substance use and misuse, mental health, early care and education, all those kinds of things, all those kinds of parts of your system, the labor force is pretty incredibly intricately involved, and oftentimes may not be as prepared as we would like them to be in their understanding of social emotional development. Third is infrastructure. We need folks who are going to really sort of run this on a day-to-day basis, the managers, the directors, and they all have to be connected. We watched a fascinating Magic School Bus yesterday in direct violation of whatever standards you're supposed to have for screen time for a 4-year-old. I certainly enjoyed the episode, though. And Isabella and I were watching, and there was a whole episode about how the sort of the underpinnings of a mushroom, the root system, somehow allow essentially communication in a forest amongst trees and other parts of that ecosystem. And that sort of infrastructure, that interconnectedness of everything is critical to not only the building of a park, but more importantly, the building of a system. And so every one of you plays some role in terms of that infrastructure. And then lastly, and in some ways most importantly, is if you build a park in the 1800s, how do you ensure that in 2020, there are still irrigation systems that keep up, that there's still maintenance and things like that? And same thing for your early childhood system, most all of which have been incredibly taxed over the last 5 months in how to respond to a pandemic, and has challenged the sustainability of all kinds of components of it. So, no, I was right, my bad. So I sometimes like people to understand what the system is that we keep talking about. And this is a way that I like to show professionals what it feels like for a family to try and navigate an early childhood system. So there's families up in the top left, and all the things that they're connected to: emergency medical services, doctors, psychiatrists, promotion and prevention efforts. Maybe it's tribal health in a community. There's elected officials, there's the health department, there's philanthropy, civic. All of these things impinge on individual children and families. And so when we say to a family, yeah, well, we're worried about your child, we have a concern, whether that concern is that their speech is delayed, they're demonstrating challenging behavior, they have some complex autoimmune disease, whatever it is, that family is part of this system. And all of these things then impinge or enhance their ability to provide what is necessary for that child. And each of these colored dots essentially have their own mini system within them, in which we have to sort of figure out what's working and not working. And all of you work within this system in some way, shape, or form and interact with the different components. It's really complex. And the idea that, well, I do mental health consultation, or I provide child-parent psychotherapy, or I do research on autism. All of those are critical components of this system and interdependent with things that you may or may not be paying any attention to, like fire and police. And yet in many places across the country, quite honestly, firemen and policemen are the first responders and the primary providers of mental health services, because they come in when there's been interpersonal violence or child abuse. And so if they don't understand mental health, we're already entering somebody into the system in a way that's not supportive of their social emotional development. So I show this, one, to freak you out, and two, to talk about how can we sort of address that. And usually at this point, we're 15, 20 minutes in, and somebody has hung up because they're like, I don't understand. I thought we're talking about an early childhood system. So we are. And I like to show this because your early childhood system in some ways is a reflection of where you see yourself in that system. If you don't see yourself as part of that system, and you're like, it's really, I looked at that diagram, this is what I do. I work at University of Miami. This is what I do. Then you're missing the point of what a system really is, because we're all on that system. And so when I think about Isabella, who I started with, and I try and keep a child in mind there. Isabella is not receiving, knock wood, any formal services. She's not in the early intervention or Part B system, well, Part B now. She is not receiving any special education services. She's in a preschool, so she's already involved with the education system. She has a primary care doc, so she's in the primary care system, and has a number of sort of community connections in terms of if she's in a dance class through our Parks and Rec. So you can start to see that while she may not be, I mean, her dad's a psychologist, so she's going to need therapy the rest of her life, probably, especially because I'm her dad. But she may not need any kind of formal interventions quite yet, but her sort of connections in the system are growing and will only get bigger as she gets older. And the more we start to think about our system as all of our responsibility, the more likely we are to develop a system that reflects how we all view that. And so I'll talk a little bit about that. I think you're all familiar with this. If you're not, Rob Corso, Lisa Fox, Mary Louise Hemmer, or somebody along those lines will find you at some point. But this is the pyramid model, and it essentially is a public health approach, which I think when we talk about, I'm not quite sure why, I don't know if somebody else is touching the slides or not, but unless it's on a timer. But this is the pyramid model, and folks sort of know. I like that somebody's toying with it. Suffice to say that this is sort of a public health approach, which is really how we think about an early childhood system. So in our early childhood system, this is a sort of a visual that we've created to sort of think about this and to help people see where they are. When you think about an early childhood system, many of us focus on the sort of top of this sort of castle, the services and supports for parents and child care providers, services for children and services for families. And those are clearly sort of our front-facing part of our store or our system. Those are the things that we're offering, and those are varied, right? So services and supports are not just the formal, I do therapy with somebody, but that may be. But mental health consultation could be a part of this. So could lots of other sorts of things that are not the formal mental health system, for example. All of those services for families. I was just on the phone yesterday listening to Head Start programs in Puerto Rico talk about the number of meals that they're delivering. Those are services for families during this pandemic. What's important to understand when you think about those services and supports are all the underpinnings of them, that you have to have some sort of policies and procedures that drive how do we ensure that all children get what they need, that we're addressing things like disparities and health equity, that there are strong interagency partnerships, not a piece of paper called an MOU. Everybody can get that. That's pretty, I got an MOU from my wife that she'll be with Isabella for the next hour. I'm not sure that means Isabella won't pop in here at some point. An MOU is a good start, but a true partnership where somebody from child welfare understands the value of mental health consultation and may even want to find ways to fund that, whether it's for them or not, that they see that as part of this system. Speaking of funding, that what we are doing in a highly functioning early childhood system is we're all thinking about the funding collectively. So in Maryland, for example, the Early Childhood Steering Committee, which is comprised of folks from all those different child serving agencies, they meet on a monthly basis. And when they talk about a grant like a Project Launch grant or an infant mental health grant or whatever sorts of funding that they're looking for, they talk about it as a group. And it doesn't mean that every single one of them is going to get something from that grant. It means that they see the importance of, if that person gets funded with a Project Launch grant, here's how it might help me in my home visiting work. We talked a bit about a prepared workforce, and there's certainly efforts. Many of you are familiar with Alliance for the Advancement of Infant and Early Childhood Mental Health that started out of Michigan and has endorsements, and folks around the country have been signing, including folks obviously in Florida. Having that prepared workforce, folks who actually understand what social emotional development is, whether you work in mental health or not. So for me, the most critical people to understand social emotional development, it's great if mental health people do, they certainly should, but I want the folks who are spending the most time with young children, folks in early care and education, folks in Head Start, folks in home visiting, primary care folks in child welfare. That's who needs to understand. And how do we prepare those workforces to equally understand social emotional development? And then lastly, and again, for some of you, this may be where you're sort of, this is where you live in the system. It's that the outcome measurement and evaluation and research that we do that continues to move our system forward. All of that is not just about treatment. And that's oftentimes a big difference between how we think about systems for older children versus younger, is that we are very focused on promotion and prevention in early childhood. Not that there aren't children who don't need treatment, but we want to do as much as we can to prevent that. And then we have all those values that are obviously about cultural and linguistic competence, child and family centered. We want this to be family driven, and it has to be grounded in sort of that developmental knowledge. So here are the kinds of things that, whether you're working on a system for children birth to 8, a system for school-age children, a system for children who are transitioning from adolescence into adulthood, it's all about understanding culture. And I think, in Florida, such a diverse state, in Miami, such a diverse community, the idea of what our system looks like has to be driven by who is our system for? Who are the members of our community? Who are the residents of our state? What are the cultural needs? What's appropriate? So as much as we like to talk about evidence-based practices, my work I've worked in all the territories, and I've worked with a number of tribal nations. That work has taught me that you can take as much of this evidence-based practice as you want. It may not actually fit, despite the fact that, we've got research to show that that's good. But is it research that's been done in this community, those kinds of things? That cultural piece is huge. Collaboration is huge. The money's going to go away. Every single one of us, I'm assuming on the phone, has at some point had some sort of funding that's come and gone, and that's the way it works. But if we're sort of trying to figure out how to do this together, we're in much better shape. What's different when we think about early childhood is that we have very different partnerships. Most children in the span of the first 5 years essentially are interacting with very similar systems. It's some sort of early care and education setting, ranging from Head Start and early Head Start to formal, regulated childcare to family friend and neighbor care. They're hopefully all going to see primary care docs for their immunizations. So we have to think about that. But we also have challenges like the diagnosis issue, that folks are really, in some parts of our system, they don't want to make a diagnosis. That's the whole point of early intervention, is to try and prevent children from getting to the point where they're at a diagnostic clinical level. I think that these workforce issues are heightened, and I think the funding sources, my experience across the country in this work is that money that comes into a state or tribe or territory doesn't really matter, but if it comes into a state, the way that it comes in is oftentimes mental health dollars in particular come in big, gigantic blocks of money, and that money very quickly goes to adult mental health. A much smaller piece goes to children, and a much smaller piece of that piece goes to very young children. And so finding those funding sources has been more challenging. We've gotten better over the years, but it's really been a struggle because there's not as much dedicated funding to that. So I'm going to keep moving. I do want to talk about services and supports. I always like to try and get a picture of my wife and at least some of my nephews in there as well. But, when we talk about this, some of these may be very familiar to you in terms of the kinds of services and supports, parent-child interaction therapy, this non-exhaustive list, obviously. But these are examples of the kinds of services and supports that may be part of your early childhood system. And so I put that here because, remember, that's what everything else is trying to support. But we have to pay for it. And those funding streams, in some ways, an early childhood system has to figure out, where's all the money coming from? So there's a great document by Kay Johnson. So anything you ever want to know about how to pay for early childhood systems and services, Kay Johnson can answer it. But these are examples, and I actually added an example at the bottom, but this is how we start to take, and I hate to say the word, we start to take advantage of things. At no other time that I can remember in the last 25 years has there been an opportunity like this to stress the importance of trying to help support young children and their families. That people are now overtly aware of what it really takes to do early care and education, about the critical importance of addressing stress and wellness and having mental health consultants available. So those conversations about how we use things like the Child Care Development Block Grant and other sorts of really complicated funding streams is a really critical conversation for folks to be a part of at whatever level they're comfortable. But it's also important, and I know that for folks who are like, I'm a service provider, I don't need to know any of this. You do, because this is how you're providing services, is you're billing Medicaid, and you need to understand what does Medicaid allow for and not allow for. It doesn't matter, I'm a researcher. It does matter, because I think that when we're trying to support the development of some intervention or some component of the system, the research and evaluation piece of it is what helps us. Research and evaluation, from my perspective, is data. It's marketing data. You take that data. Deborah Perry in Maryland took data from a pilot site evaluation of mental health consultation, and with several families who had benefited, went to the Maryland legislature and got them to give a $25,000 pilot site investment turned into $1 million investment statewide. Those kinds of things are really important. And obviously some of this COVID funding that's coming across is going to be helpful for us to start to explore. So the implementation of that system, going back to my park, is they had something called the Greensward Plan. And that really was major shifts in what was already in place landscape-wise, and major shifts that had to be made in terms of that greenery. So when we think about implementation, we have to start to think about what's our strategic plan? What is it that we want our system to look like? What is our system for young children and their families? How do we implement that? How do we develop the workforce? How do we pay for that? All of that has to be discussed, not just we start digging up the park and planting things. And what it means for you in Florida or in Miami or wherever you may be is at a systems level or even a program level, there are things that you could be doing that might be helpful here around trying to advocate for more cross-training, for example. One of the best projects I ever was on was a project where we tried at a state level to bring mental health folks and substance use folks together. In some places, I'm trying to remember that, in Arizona, they were both on, I'm just going to make this up unless you lived in Arizona, and then you can call me on it. I think they're on the 6th floor of the same building, and literally substance use on this side, mental health on this side. They never talked to one another. They never did things. So we started doing cross-training. Have the substance use people train the mental health people on the issues that they need to understand about substance use and misuse, and vice versa. For me, when I think about the trainings that I've been in that are child welfare trainings, I'm not a child welfare worker, I'm a mental health person, but what I've learned is this is why their approach is their approach. This is what they're trying to do. That's really helpful. And at an individual level, to come to understand what is our system, that all those bubbles that I pointed to, I wonder how many of you could actually say, I know exactly who goes in each of those bubbles and how they connect and things like that. So I put a lot on here because, I think the best thing to do is to make it as many words on a slide as possible. It's the opposite of good sort of training, but bear with me, is that in Central Park, they actually essentially started to think about things like, how would we have sunken roadways? How would we sort of use shrubbery to screen things in so you wouldn't sort of even understand that there was a city out there? And that really became an architect, a gardener, an engineer, and politicians, in addition to sort of the oversight folks, working very hand in hand. In a similar way, when we build a system, it's a public health approach. We think about those evidence-based practices. We choose what are the right interventions. I get asked this question all the time from folks around, I just got asked this actually today by by some community that experienced a tornado last year, and like, we're going to do second step. What do you think? And I'm like, I think second step is great. It's a great evidence-based intervention. I have no idea if that's what you need, because you have to think about, who are we trying to serve? What are the outcomes that we're trying to get to? And how are we going to measure whether that's had that impact? And so it's not a yes or a no. It's actually choosing those interventions based on sort of our cultural understanding, having families help drive those choices and things like that, thinking about the funding and the workforce and those partnerships and sort of infrastructure that might help. So I'd be interested for y'all to start to think about, and maybe we'll sort of, we can also leave this for a little bit of the Q&A discussion time if you want, but to start to think about EBPs. Are there any things that you got funding to do, or you were doing research on, and it didn't go? There was no staying power, or there were ones that you've been doing for 20 years. We've done the same intervention for the last 20 years. Thinking about, where's the workforce that's doing promotion and prevention? It's much easier, quite frankly, to pay for treatment. If we can give a child a diagnosis and get him into therapy, not that that's easy, but that is easier in the sense of, we will get an insurance company, we'll get somebody to pay for it generally. Not always, but generally. Tell me how you're going to pay to do something that will ensure that somebody doesn't end up needing a diagnosis. Who wants to pay for something that we can't even prove prevented the child from having that disorder in the end? So thinking about, who's that workforce and where's the funding for it? And then starting to think about things like mental health consultation. Are you doing it to scale? Certainly I have some sense of what's happening with mental health consultation in Miami, but where's the pyramid model? Are you doing some sort of social emotional curricula across early care and education settings within the community or within the state? Are there endorsements, professional development standards, so that we can start to ensure that anybody who's doing this work has some level of competence? And so those are the kinds of things to start to think about where you're at. The other piece is about the sustainability piece, that in Central Park, they certainly thought about these different zones that they created, that every zone had a specific individual who was sort of accountable for day-to-day maintenance, but then they all sort of work together. And one of the things we've learned about sustainability of systems is that those relationships and true leadership are what drive systems development. So I could tell you a specific person in random places across the country who's been the person to drive the development of that early childhood system. And some of them are not there anymore, but they started enough and brought on other leadership and developed relationships. And those relationships are what stand the sort of the biggest factor in all this, which is political change. That you could be going along really nicely, and then you get a change at the council, city council, county council, at a governor level, or certainly at a national level. Those political changes certainly shift areas of emphasis. For those of you who are old enough to have used a VCR, so I'll just say it that way. You remember at some point we had a huge emphasis on literacy, on reading acquisition. And so all of us would write towards reading acquisition. This is why we need to do social emotional development interventions, is because it's going to help with reading acquisition. There's a big emphasis. Not that it's a bad thing to learn how to read, but that's sort of where politically things went. And so it's important to understand that the relationships between folks at supervisory levels, within the workforce, at managerial levels, at local levels, community levels, state levels, whatever you want to talk about, those relationships and that leadership is what drives the system to be able to sort of sustain. And what leaders do is they ensure that that intervention gets to the right person, that they don't just pick a particular intervention because it's the thing that everybody seems to be doing. And there are any number of really good early childhood interventions, but it's picking the right one, making sure that it's the right one for the right group, and that it's being implemented by the right people, and that you can sustain it. Because there's nothing worse than building up momentum and demand for a particular service within your system that you then can't sustain. And so I think that that's what a good leader does. The other part is to think about the workforce and the use of evidence-based programs as much as you can that are defined by the community. And I've learned this lesson the hard way in some ways over the years around people who are very quick to just try and do something because they want to do something. So in Colorado, it's very interesting in terms of like training, for example. Colorado had this huge federal system of care grant, $12 million, something like that, to serve four counties. But instead of just using it and getting a bunch of people trained on a bunch of things, what they did is they made a matrix. They really like to make matrices in Colorado. But so they made this matrix and they said, what are all the trainings that we think over the next 5 years our workforce needs? And why? And how do we roll those out so that it makes sense? Because we probably shouldn't do this training until they've had this training and tried to implement this. And that, in that way, they were very thoughtful about what is going to serve that community best. The most important piece of all of that then is this last piece, which is how did we actually assess the impact? How did we do research to understand clearly what was working and not working? One of the first grants I ever got in DC right after my internship was I must have tricked somebody and they gave me a grant on violence prevention. And it was a 2-year grant, and it was quite honestly horrible because people really wanted to do something. We didn't really get a clear direction. I don't think that we did the best job of assessing that impact, and it sort of disintegrated because leaders thought we should just use the money to do whatever they wanted rather than follow the sort of the scope of what we proposed. Families wanted something different. It just became sort of clear that we hadn't actually done many of these things, and it was a great lesson learned, and sort of then we could come back and try and do it again. But all of these are critical in that system. The other piece is that there's not an early childhood system anywhere yet that's sort of done. There's no endpoint. There's no sense of our early childhood system. All those bubbles are completely, clearly connected. Every single group knows exactly what the other group does. There are systems that are more farther along in their development, but it really does sort of entail lots of planning at the beginning, lots of continuous quality improvement efforts along the way. In Boston, Massachusetts, I don't know if there's another Boston anywhere, so I don't know why I said it, but it just felt like the right thing to say. In Boston, they were trying to do their intervention with some of the federal funding that they did over the years was to place in primary care and public health, in community public health settings, they would have a family sort of navigator, somebody who understood the system, and a mental health person positioned there. And the idea is that if for some reason a mental health, behavioral health concern came up during the well-child visit, they would literally have a warm hand if they'd walk across the hall and say, hey, I'd like you to meet this team. This is a person, family member just like you, who's tried to figure things out. Here's a mental health person who can try and help you figure things out. But what they did that was really interesting was that in each of the 4 different settings, they worked in Roxbury. They had 4 different sites. One of them was a health clinic for children and families who are homeless. Each of them had their own continuous quality improvement study that they were doing, because in one place, maybe it was that people weren't completing referrals. In another one, it was that they couldn't get people to even come in. They could get people to come in the first time, but then they wouldn't return for a second visit. So they would sort of do a study of what were the factors impacting that. So what you need to do is you need to take a long view. So when they design Central Park, when you design an early childhood system, you should not expect it exactly the way you draw it. And that is literally what I would encourage folks to do, is to draw your early childhood system. How do all the players connect? What's the workforce, the infrastructure, the policies, the financing, the research and evaluation? You have to take a long view that every time you sit back down with that drawing, you might change something. That maybe in developing retention ponds, making this up, I don't know these things, retention pond 7, it didn't work quite that way, or the boathouse needed to be shifted a little bit because of some particular landscape issue. You take this long view. And I know for me, as I look at the picture of my dad with me as a young child and me with Isabella as a young child, there's a long view here. Whatever my dad envisioned for me is probably different than where I'm at right now. And what I envision for Isabella is likely going to be different than where she ends up. But I think as long as we have some vision that we're working towards, that we're open to the idea that that system changes, and that we make clear that all of us are part of that early childhood system, we have a much better shot of at least trying to develop something. So,
thank you.